vaccine because it is free and it is safe. It's going to protect you from coronavirus. So we are here in the market. We want you to come and take your vaccine if you are not taking it. Even if you are taking the first dose before for the AstraZeneca, and you were told that you should wait for the second dose, you are now having the opportunity to come and take the last dose.
We started the COVID campaign in May this year, from the 10th to the 12th, and it was the first time in county to have the COVID vaccines. Because of the rumors from the community, from Facebook and other things, there were a lot of myths about the vaccines. But to our surprise, when the vaccines came in May, we received 2,640 doses, and we have 2,298 persons taking their first dose of AstraZeneca. And that was a plus for Maryland County because in the entire Southeast, no county reached that benchmark.
As partners in health, one thing is that we always talk about equity. And one thing was to ensure that with this quantity that we had, it was not a lot. And again, just short expiry, we had to think of which people to really focus on. And mostly what we targeted was the elderly and the ones with any other comorbidity, like diabetes, hypertension. Those were patients that we were focusing on.
There are a lot of strategies we have employed yet. We have the mobile team, we have the fixed site team that is posted at facility, and we have the outreach team. So we use all of the strategies. We use the fixed site strategy, we use the mobile strategy, and we use the outreach strategy. So these are the three strategies that we use, and because of our strategies, people are coming in for the vaccines. We're reaching out to the people. Because if you are seated, some of the people will not come to you, but if you go out in the community, the people are happy to see the team there, so they are encouraged to take the vaccines.
Basically, we focused on the clinics, where like one of the hospital called J.J. Dawson in the Southeast, where we are working as partners in health. And we targeted the patients there so that we could give at least the first dose to them.
Be there the whole day. Tomorrow you go to Wutu Gate. The after tomorrow you go to Conakry. Because people in the field are already carrying out one hour. So far the last time when the field, oh man, they say, oh yeah, we got it, we got our vaccine.
So during that time there was a lot of community awareness, a lot of engagement with the community. And one thing that we learned was to go to the community, to educate the community, starting with the leaders, the community leaders, the community spiritual leaders, and also the faith healers. Because basically most of us have more faith in them. And the best thing is to start with those, letting them to understand. And we found it working, and we actually immunized quite a number of people during that time.
At the level of the facility, the team is posted there. Anybody who go for hospital care gets the vaccine from health education at the level of the facility. And the team, the mobile team, they move out into the community. They move out into the community and organize a temporary site. And once they organize a temporary site, they create awareness. They create awareness for the community members and give them the vaccines. So for the outreach team, these are people who travel 2 to 3 hour distances away from the facility. They travel a longer distance to the facility to get those people. But those people who are far from the facility, like 2 to 3 hour distances, can walk to come to the facility for vaccines. They will feel that they were not important, so we decided to move the team to them in 4 to 5 hour distance to get them taking the vaccines. communities in county, especially when it comes to though we getting support from our partners, but our terrain is difficult. Yes, not all our roads are accessible. We have rough roads, and getting our supply to the interior is difficult for us. So we have to hire motorbikes, and then people riding motorbikes and other things is a challenge for us.
It takes about 5 to 7 days to bring vaccines down. So we have to partner with others like MAF, that's the Mission Aviation Fellowship, and also Samaritan Purse to help us bring the drugs. At least that takes about 1.5 to 2 hours to bring them down. And once they come down after a collaboration and partnership, we are able to assist the government or the Ministry of Health to distribute to the other 5 counties within the Southeast.
At the level of our county, we have Partner in Health. Partner in Health for logistics, they help us. For even personnel, they help us. The personnel come to join our personnel to go out in the field, give the vaccines to the people, create awareness, and they provide vehicles, and even give lunch for our vaccinators who are in the field doing the work to encourage them to work more. We also have WHO. The sub office is here, and they are working along with us with other NGOs like Partner, like Breakthrough Action, UNICEF, and STIP. STIP is a USA-based organization also.